Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I'll be talking about how do we treat acne scars, what is the treatment for the acne scar. Acne is a very common condition that many young children go through, and adolescent and teenagers have this problem. But the thing is, acne, if treated properly in early stages, will have no bad consequences or harmful effects. But if acne is not being treated timely and is not controlled at the right time, it often leaves very bad scar marks which cover the whole face, and then we have to do some treatment for the acne scar. So the first advice is, if you are having acne, try to control your acne in the first place. Do not allow them to become rampant or too aggressive so that they cause very bad scars. So treat them very aggressively in the first stage. Do not allow the scars to form. The second thing which I want to tell you is, there are many things, like many youngsters, like boys especially, when they're going to gym, they are using anabolic steroids to build up their body. Now steroids are linked up with very aggressive form of acne formation. Even the use of whey protein is also linked with the increased formation of acne. So in case you are having acne, and stop using any supplements which have anabolic steroids, whey protein or things like that, which can increase the formation of acne. In case of girls, we commonly see polycystic ovarian disease, PCOD, is often linked with severe acne. So in that case, if PCOD is there, go for weight reduction, decrease your carbohydrate, increase protein in diet, and also in some time you may require some hormonal medicines and some other medications to control your PCOD. These are few things we have to keep in mind to reduce acne in the first stage. In case you are suffering from acne scars and you couldn't stop your acne, or acne was not stopped initially, what can be done? So my friends, the good news is that with acne scars we can get very good results with the various treatment modalities that are available. I will tell you what are the common modalities that are being available now for the treatment of the acne scar. First, we must understand acne scar is of different types. It can be ice prick scars. Now ice prick scars are very pinpoint scars that we see on the whole face, like somebody has poked a needle on the face. Very narrow, small scars. Then there can be rolling scars. These are like depressions, but these depressions, if we stretch them, these depressions are reduced, they become flat. There can be box scars, which are very deep pits and cavities which even by stretching cannot be straightened. Then there can be scars which have got a lot of hyperpigmentation. Sometimes we have got pus, so pustular acne can be there, and they can also lead to some very severe scars and keloids and hypertrophic scars. The treatment is different for different kind of acne scar. In case of ice prick scars, the best treatment that we can think of is TCA cross. This is one technique where we use a compound called TCA in about 100%, or some people use 60%, and then we give it deep inside the cavity of ice prick scars, this TCA, and TCA cross is the technique that is used. Coming to the rolling scars, I said rolling scars are depressed scars, but when we stretch them on the borders, they straighten up. But then the best treatment is a surgery, cosmetic surgery called subcision. Basically what we do in subcision is we take a needle, Nocar needle or any needle, and we cut the fibers that are attaching these scars down to the dermis, and we cut these fibers, and this is a surgery that is being done. So we do subcision. We have modified subcision to reduce the bleeding and to reduce the amount of pain by using tumescence, and also using special needles to reduce the pain and bruising and bleeding after the subcision. Following the subcision, another thing that can be done to reduce these depressed scars is the use of either CO2 lasers that can be used in a fractional mode, ultra pulse mode, or different modes to flatten these depressed scars. Then for the box scars, what we use is we do punch elevation. We elevate these grafts, these scars using punch excision, and then we can use along with that some other techniques also. The other thing that we can use in acne scar that's coming up and that's doing very well is the use of Dermapen along with some growth factors and PRP. So that's another thing that is being used. For depressed scars also, fat grafting is coming as a very good option now. So we can also put fat grafting into them to elevate the depressed scars. Another very important thing that we want to tell you is for hyperpigmented acne scar, the various ointments like azelaic acid is very good for the acne scars, kojic acid, hydroquinone, they can also work, but azelaic acid is especially the drug of choice for hyperpigmented acne scar. Also we have to give some regular chemical peels like salicylic peel and salicylic mandelic peels. So in acne scars or with active acne, we always use some chemical peels, as I said, to improve the results. Now coming to hypertrophic acne scars, for them we have to give some injections of steroids to flatten these. We also use silicone ointments and silicone sheets to flatten these and to make these scars flatter. So friends, these are the various treatment modalities that are available and that can be used for the acne scar, and we are using a lot of these modalities. Acne scar treatment is not a one-day procedure. It may take 6 months, 8 months using the various modalities, but if you are patient enough and you go through all the treatments, you can expect a very good result, say from 60% to 80% improvement depending on what treatments have been given, how severe is your scarring. But my observation is with acne scar we can expect excellent results, even very good results depending on the case, but it will take time, 6 to 8 months. Multiple modalities have to be used. It cannot be done in one sitting and with one modality. So thank you friends. I am Dr. Sandeep Bhasin, hoping to see you sometime in future.